Assalamu alaikum everyone. My name is Habiba and I'm the student of biotechnology at the University of Management and Technology. The topic which is assigned to me to present is neuroendocrine tumors. In this video, I will first discuss about the introduction of neuroendocrine tumor. In this topic, I will give you the overview of classification and clinical presentation of neuroendocrine tumors and the location where it commonly occurs. A neuroendocrine cancer, often referred as neuroendocrine tumor or neuroendocrine neoplasm, in which neuro means nerves. Nerve cells are the cells which receive sensory input from our external environment and send command to our muscles to react about that stimulus. And the endocrine refers to the cells of neuroendocrine system. A neuroendocrine tumor begins in the specialized cells of the body's neuroendocrine system. These cells have traits of both hormones producing endocrine cells and nerve cells. They are found throughout the body's organs and helps to control many of the body's functions. Hormones are chemical substances that are carried through the bloodstream to have a specific effect on the quantity activity of the organs or cells in the body. Most often, neuroendocrine tumors take years to develop and grow slowly. However, some of the needs can be fast growing. It may occur in any part of the body. As I have told you that these tumors can occur in any part of the body, it may be occur in our gastrointestinal tract, which includes parts of the body from esophagus to the anus. It maybe occurs in our lungs and pancreas also. First, we will discuss the gastrointestinal tract neuroendocrine tumor. The NETs develop most commonly in our gastrointestinal tract, which is anywhere from our esophagus to the anus. Most often, they form in the small intestine, which is also known as small bowel, and mesentery, the tissue securing the intestine to the belly's wall. Another frequent location is the rectum, which is the last section of our large intestine. Especially in large intestine, the probability of occurrence of tumor is 20%. In small intestine, it is 19%, and in appendix, it is 4%. The gastrointestinal tract plays a central role in digesting our food and liquid and also in the processing of the waste. So, the tumor which is occur in our gastrointestinal tract are known as carcinoid tumor. Here are the signs of gastrointestinal endocrine tumor. Gastrointestinal NET symptoms may occur because tumor releases the hormone serotonin, which is most common and usually known as gastrin hormones. Symptoms can also come from the tumors growing or turning cancerous and spreading. High serotonin levels. When gastrointestinal carcinoids makes and release serotonin, the liver usually processes the extra amount with no impact on the body. But if the disease spreads to the liver, the organ cannot keep up. In fact, metastasis in the liver may release even more serotonin. High serotonin levels cause a condition which is known as carcinoid syndrome, with about 40% of gastrointestinal carcinoids triggering this complication. The carcinoids are most commonly found in the small intestine, the appendix, and the start of the colon. The symptoms of carcinoid syndrome includes diarrhea, flushing, which is the warmth and the redness in our face, wheezing, a whistling sound when breathing becomes difficult. Effects of gastrin hormone. Another gastrointestinal NET gastrinoma can cause different symptoms by releasing the hormone called gastrin, include with the tumor experience diarrhea, steatorrhea. It is the excretion of the abnormal quantities of fat with the feces, which are owing to reduce the absorption of fat by small our intestine. Other one is peptic ulcer. These are painful sore on the lining of the stomach or small intestine. Here are some of the signs of NET. Other signs of gastrointestinal NET comes from the tumor reaching a large size, blocking the gastrointestinal tract or interfering with the liver. They include belly pain, constipation, fatigue, jaundice, nausea and vomiting, rash, redness, and particularly dark stools from the intestinal bleeding and unexplained weight loss. The next location where the neuroendocrine tumor occur is our lungs. The lungs is the second most common location of neuroendocrine tumors. About 30% of NETs occurs in the bronchial system which carries air to the lungs. Those airways includes the trachea, the bronchi which running from the windpipe to the lungs and bronchioles, which are the smallest branches of bronchial system. Lungs and it is also used to call carcinoid tumors. Cells in the lung carcinoid tumors look more or less like the normal cells. Doctors call these well differentiated. They break the lung carcinoids into two groups which are based on their further appearance and how the tumors act and respond to the treatment. They are typical carcinoids and atypical carcinoids. The typical carcinoid cells in these tumors look the most normal. These tumors often located in the center of the lungs or the windpipe, which are typically grow slowly and usually don't spread beyond nearby lymph nodes. So the lymph nodes are basically, they are spread throughout our body. They are present in our neck, armpits, glands, and around our gut also. They filter the substances which travels through the lymphatic fluid. So lymphatic fluids contain white blood cells which are basically related to our immunity system. Next, we will discuss the atypical carcinoids. These tumors often found at the outer lung edges may show signs of the necrosis. Necrosis is basically the cell death, and mitosis it is the greater division, cell division. Some grow slowly like typical carcinoids, while the other act more aggressively. They divide fluently. At diagnosis, up to 50% of atypical carcinoids have spreads to the lymph nodes in the chest. They may also metastasize to the bones, most frequently and the liver. Still, they remains highly treatable and spread more slowly than others, most common lung cancers. Neuroendocrine cancer cells are poorly differentiated, are very unusual compared to normal cells. These cancers behave more aggressively and can spread to our brain, which is most common. Liver, bones, and adrenal glands. They include the form of small cell lung carcinoma, cancer called large cell neuroendocrine carcinoma. These are some symptoms which are related to our lung neuroendocrine tumor. Neuroendocrine lung tumors may not cause the symptoms until they grow larger or spread. When they do occur, most common symptoms are asthma-like. They include cough that you cannot rid of and through it may vary in intensity throughout the day, coughing up small amount of blood, fatigue, frequent chest infections such as pneumonia. So pneumonia are the infection which is caused in our lungs and our air sacs which are the smallest unit of our lungs filled with the pus. Next one is pain in chest or shoulders and shortness of the breath. Lung neuroendocrine tumor symptoms which ties to the hormones. Some neuroendocrine tumors release hormones which can cause their own set of symptoms, while the only 10% of the lung NETs cause this complication. It's still something doctors needs to watch carefully. Most hormone spikes from a lung neuroendocrine tumor involve adrenocorticotropic hormone. High adrenocorticotropic hormone can cause a condition which is known as Cushing syndrome, which is marked by the high blood pressure, low potassium, and weight gain. We watch for these symptoms and treat them as needed. Less frequently, people with the lung cancers experience carcinoid syndromes from the tumor releasing serotonin or related hormones. They may experience diarrhea, wheezing, flushing, as we discussed previously. Our gastrointestinal symptoms management for neuroendocrine can be helped. The third location where neuroendocrine tumors occurs is pancreas. Approximately 7% of NETs can develop in the pancreas. Pancreas is basically a pear-shaped gland located in our abdomen between the stomach and spine. Pancreas neuroendocrine tumors used to call islet cell tumors. Pancreatic NETs are not same as pancreatic adenocarcinoma, which accounts for more than 90% of pancreatic cancers. Here are some key differences between the pancreatic adenocarcinoma and pancreatic neuroendocrine tumors. So first one is cell types. Pancreatic neuroendocrine tumors form in neuroendocrine cells which release hormones. These cells sit in the cluster which is known as islets, which is why pancreatic neuroendocrine tumors are called islet cell tumors, and pancreatic adenocarcinomas develops in the exocrine cells which releases digestive enzymes. Symptoms: pancreatic neuroendocrine tumors and adenocarcinomas share some same symptoms, but pancreatic neuroendocrine tumor also cause their own signs of disease if their cells continues releasing hormone. About half of the pancreatic neuroendocrine tumors behaves this way. Outlook: a pancreatic adenocarcinoma is usually a fast-moving disease. Pancreatic neuroendocrine tumors grow slowly in most cases. So, even though the disease has often metastasized, which is the suppression of our tumor, by diagnosis, the prognosis for pancreatic neuroendocrine tumor is typically more promising. The exception is a more usual type called pancreatic neuroendocrine carcinoma, which is pancreatic NEC. These tumors grow, spread quickly. The next heading is pancreatic neuroendocrine tumor types and symptoms. Let's first discuss the signs and symptoms regarding pancreatic neuroendocrine tumor. Sometimes symptoms of pancreatic neuroendocrine tumors occurs because the tumor has grown large or turned malignant and spread. These symptoms can overlap with other conditions including more common form of pancreatic cancer. Signs and symptoms include back or belly pain, bone pain, diarrhea, indigestion, jaundice, which is the yellowing of skin or eye, loss of appetite. Loss of appetite is when you don't feel hungry. Lumps in the belly, shortness of breath and coughing, unintended weight loss. About half of the pancreatic NETs release the hormones that upset the body's normal balance. This hormone distribution may cause noticeable symptoms to show up while tumor is still small. Pancreatic tumor, which is based on hormones released. The particular symptoms experienced depends on the form of the tumors named after the principal hormones released. The first one is gastronomas in the pancreas. The first hormone is gastrinomas in pancreas. Gastrinomas are one of the most common hormone releasing in pancreas and may also occur in abdomen, which is the small intestine first section of our digestive system. Sometimes there are multiple tumors. Gastronomas release gastrines, which boost our stomach acidity. Symptoms which cause Lingers-Ellison syndrome or include diarrhea, peptic ulcers, and steatorrhea. Insulinomas. Insulinomas are another common hormone-releasing pancreatic NAT. Diagnosis requires staying in the hospital for several days for testing only. The tumor releases extra insulin, which leads to hypoglycemia. It is the disease in which we have low blood sugar, which can cause neuroglycopenia or the brain function interference and obesity. It is the fatness. Glucagonomas. These tumors release glucagon, a hormone that increases blood sugar. Symptoms include anemia, blood clots, diabetes, and Gauss disease. Necrolytic migratory erythema, which is particularly the rash which is around our genitals, anus, buttocks, groins, and lower legs. Intended weight loss. Intended weight loss is weight loss without changing your diet or exercise routine. VIPomas, these tumors release the hormones vasoactive intestinal peptide, which causing echorrhea, which is lack of hydrochloric acid in stomach juices, a flushing on redness in our face, hypercalcemia, too much calcium in the blood, hyperglycemia, high blood sugar, hypokalemia, low potassium, metabolic acidosis, too much acid in the body, and watery diarrhea. Somatostatinomas, they are rare tumor release somatostatin leading to diabetes, diarrhea, gallstones, hyperglycemia, hypoglycemia, steatoria, intended weight loss. The last one is pancreatic polypeptidomas. These rare tumors release pancreatic polypeptide, sometimes causing belly pain, hepatomegaly, and watery diarrhea.